Hi all, welcome to LXS Aaron Academy. My name is Soumya. I have passed my NCLEX Aaron exam in 2024. Currently, I am in USA. So, in this video, I want to share some what important points. That means how we can prepare for our NCLEX Aaron examination. We know that for an NCLEX exam success, we need an NCLEX focused theory, clear understanding of the theory, and this theory we need to apply it into the question analysis. So we need critical thinking and clinical judgment. So I'm not going into too deeply, I'm just giving a clear explanation of the theory plus how the theory is applying in a question analysis. That's it. Okay, so I have chosen one topic, sickle cell anemia. So I will tell you about sickle cell anemia, the definition, pathophysiology, clinical manifestations, diagnostic tool, management, and one question analysis. So if you are following my class, you can join our academy so that you will get a complete clear understanding of the theory as well as the question analysis. So we can move on with the topic. Okay, so we know the sickle cell anemia. Do you know about it? What is sickle cell anemia? From the name itself, that means anemia means we know what there is a decreased hemoglobin level, that is the anemia. But in sickle cell anemia, what happens is that the HB level or the RBC, okay, the red blood cells will become in a shape of sickle. Okay, that means the RBC become the sickle shape. That condition is called sickle cell anemia. So how it is happening? Okay, see in the picture we can see the normal red blood cells and the sickled red blood cells. That means the sickling means this is a curved portion. Mostly the shape of the RBC is sphere shaped. Okay, but in case of sickle cell anemia, what happened? The RBC will become sickle shaped. So what happened? It will obstruct the blood flow through the blood vessel. See in the picture we can see in the first picture shows the normal blood vessel with the normal RBC. Okay, but in second picture we can see there is a sickling of the RBC. What happened? This RBC will lodge in the blood vessel and it is occluding. It causes occlusion and it causes obstruction of the blood flow. Okay, this is the main important what changes which happen in our body. That means it will mainly interrupt with our blood flow, normal blood flow. Why it is occurring? Because the normal RBC is becoming sickle shape. So next we can understand how it happened. Okay, so we can move on that. The sickle cell anemia, it is an autosomal recessive disorder. That means it is a genetic disorder. Mainly what happened here, the sickling of the RBC. We know that how the RBC is producing. That means this has in our hemoglobin. That means the hemoglobin has two parts. What are the two parts? That means the one part is the heme part that we know, the hemoglobin. From the name itself we can know the hemoglobin has two parts, heme part and the globin part. And the heme part is the iron containing part, and iron is the one which bind with oxygen. That means we know the oxygen is carried through the blood. So through the blood, how the oxygen is carrying with the help of the heme part in the hemoglobin, which help to carry oxygen through the blood. So what is the function of the globin part? The globin part is the protein part, and this is the 4 polypeptide chains. Okay, that means 2 alpha and 2 beta are the two parts of the globin part. Okay, mainly this is causing the production of the hemoglobin. Okay, that means this globin part is needed. That is this is the protein part or amino acid part which is needed for the production of the red blood cells. Normally we know that the normal hemoglobin is HbA. Okay, the normal hemoglobin is HbA, but in when the hemoglobin or red blood cell becomes sickle shape, what happen? This hemoglobin A will convert into hemoglobin S. how it happen. Normally the heme part, that means the HbA, at the sixth position, that means the beta chain. We know that this globin part has two alpha and two beta part, and this chain part, that the beta chain, the sixth position of the beta chain, normally it is replaced with the glutamic acid. Okay, which one? Glutamic acid is the amino acid. But in case of sickle cell anemia, what happened? This the sixth position of the beta chain, which is replaced with, instead of glutamic acid, which one is it replaced with the valine. So the valine will cause the changes of the shape of the RBC. That means the normal RBC will become sickle shape. How it is? The HbA will replace with the what? HbS. So whatever the hemoglobin part, hemoglobin has the valine in their hemoglobin chain, it is causing the sickle shape RBC. Okay, so I hope you understood about how the sickling of the RBC is happen. Okay, usually what happen means that this will cause, because in the picture itself we can show this hemoglobin S or sickled hemoglobin will obstruct the blood flow. Okay, and it can lead to vaso-occlusive crisis. That means it can lead to occlusion of the blood flow. And this sickled hemoglobin will make the blood into sticky. That means the consistency of the blood will become sticky. Okay, because blood is not flowing normally. We know the blood need to be flowed through the blood vessel, but when the RBC becomes sickle shape, the blood flow is getting interrupted, which can lead to what? Vaso-occlusion. That means the occlusion of the blood flow through the blood vessel. So what happened? This sticky and stiffened sickled hemoglobin will easily prone to hemolysis. Okay, and it can cause vaso-occlusion. This hemolysis can lead to what? Anemia, and that anemia is termed as the sickle cell anemia. Hope you got what is sickle cell anemia. Nothing, it's a genetic disorder. What happened here? The RBC will become sickle shape. Okay, normally hemoglobin is HbA, and it is when the hemoglobin sixth position beta chain is replaced, instead of glutamic acid with valine, HbA is converting into HbS, and it can cause sickle shape of the RBC. It will cause the occlusion of the blood through the blood vessel. It can lead to vaso-occlusive crisis. This is the event which happened in the sickle cell anemia. Okay. So what are the main etiology and risk factors? Mainly it is affecting, I already said, it is an autosomal recessive disorder. That means for getting a child with sickle cell anemia, both parents must be a carrier of this gene. Okay, that means the HbS gene can be affected with, that means the both parents should be the carrier means they are not infected, but they have this HbS gene, abnormal gene in their body. That means they are acting as a carrier. So both parents are having this HbS gene in their body, there is the 25% chance for getting the infection to their offspring. Okay, or to their children. So the main triggering factors are infection, dehydration, high altitude. That means when you are moving into a high altitude, that means if you are the mountain climbers, okay, like that, if you are moving into a high altitude, and the stress, extreme stress, blood loss, fever, these are the main etiological factors for which cause the sickle cell anemia. So I have already said what happened in the sickle cell anemia. The RBC, the normal sphere shaped RBC, will become sickle shape, and it will obstruct the blood flow. Okay, this is I have already explained with the first picture, because here the shape of the hemoglobin is abnormal. That means the normal HbA will can be low, and the abnormal hemoglobin, that is the HbS, will be higher. So it can lead to vaso-occlusive crisis. Mainly the sickling of the RBC cause what? Low oxygen, because this HbS or hemoglobin S will get polymerizes, which can lead to what? Sickling of the RBC. So it can lead to what? Hypoxia is the main thing, because here, as because of the vaso-occlusive crisis, hypoxia can be occur. Okay, and this, which will mainly, it will obstruct the blood flow. We know that when the blood is getting obstructed to the blood vessel, what happened, the blood will become thickened, stiff, and become rigid, and it will obstruct the capillaries are the minute part of the which helping for the blood flow. But if the blood is becomes thickened and hardened, the blood will not move through the capillary, and it can lead to what? Vaso-occlusion. That means the occlusion of the blood vessel. It can lead to ischemia means low oxygen in the blood. Okay, that means the ischemia, and this ischemia can lead to what? The hypoxia, ischemia can lead to severe pain. Okay, that means we know the hand and foot are mainly supplied the blood by the capillaries. So here this thickened blood will cause the vaso-occlusion. So hand and the foot, that means the distal part of the body, won't get adequate perfusion. So it can lead to what? Severe pain, and the hemolysis can occur. It can lead to jaundice and anemia. Okay, and because of the occlusion of the blood flow, the spleen become congested, so it can lead to splenomegaly. Okay, and if there is a splenomegaly, what happen? The spleen will destruct automatically. That means the auto destruction of the spleen occur in case of sickling of the RBC. Okay, and it can lead to the inadequate perfusion to the distant organs. So what happened here? The organ will get damaged. Why? Because the organs like brain, lungs, kidney are not getting adequate perfusion, so it can lead to organ damage. So what are the changes occur in our body whenever RBC is becoming sickling? One thing, we are getting what? Anemia. Okay, that means the ischemic changes, low oxygen carrying capacity leads to severe pain. The hemolysis cause jaundice and anemia. The spleen become congested, it can lead to splenomegaly, so autosplenectomy can occur. So main and other complication is osteomyelitis. Osteomyelitis means it is the infection of the bone and bone marrow. We know that RBC mostly produced from the bone marrow. So by here, the because of the sickling of the RBC, what happened? It can lead to the infection. That means we know the our body is getting an immune protection from the spleen. Okay, so here the spleen is not functioning normally, so it can lead to our body will prone to get infection easily. Mostly Staph aureus or Staphylococcus aureus can cause the inflammation of the bone marrow and bone, and it can lead to what? Osteomyelitis. Okay, that means you have to remember one thing: the sickled RBC cause the blood sticky stiff, and it can cause obstruction of the blood flow, and it can lead to what? Splenic atrophy, infection, and osteomyelitis. Okay, next we can see what are the signs and symptoms which are related to the sickle cell anemia. Mostly it affecting in infant, mostly the colic in infant, that means abdominal infection. The blood flow is getting interrupted. It can lead to what? Death of the tissue on the abdominal organs. Okay, abdominal organs tissue infection can occur. So why? Because of the occlusion of the blood flow through the blood vessel. Okay, mainly the sickled RBC will obstruct the blood flow. That is the core reason for other conditions. Okay, and also in the infant hand-foot syndrome, we know that here there is an inflammation of this hands and foot can occur, and that is called the hand-foot syndrome. Other name for the hand-foot syndrome is the dactylitis. That means the fingers are getting fingers and toes are getting inflammation. Okay, and because of the enlargement of the spleen, later it becomes fibrosis of the spleen, and the obstruction of the blood flow, the peripheral circulation is getting interrupted. It can lead to formation of the ulcer. That means the pooling of the blood in the blood vessel can lead to what? This stagnation. Okay, that means it can lead to leg ulcer. Delayed growth, that means adequate nutrient, that means oxygen is not carrying through the blood properly, and it can, we know the for our normal metabolism, oxygen is needed. So what happened, it can lead to delayed growth, and body will prone to get infections like hemophilus influenza and streptococcus pneumonia. That means the child will frequently get infection with the hemophilus influenza, pneumonia, and the level of the hemoglobin will be low. Mostly the because here the normal HB is not present, because HbA is the normal hemoglobin, but here instead of HbA the concentration of the HbS is high, that is the sickled HB. So now when we do the lab test, we will get the hemoglobin level 6 to 9 gram per deciliter and the increased reticulocyte. Okay, so the blood flow to the organs, the major organs are getting interrupted. It can affect the normal functioning of the brain, kidney. Okay, if it is brain is affected, it can lead to stroke. The kidney is affecting, it can lead to kidney failure and hematuria. And if the lung is affected, what happened? The lung infection, mostly pneumonia can occur. And bone osteomyelitis, the inflammation of the bone and bone marrow, it can lead to necrosis. Okay, so in an infant, the early signs, because it is a genetic disorder, mostly the child will born with sickle cell anemia. So we can detect this in the early stage of an infancy period. Mostly the colic, okay, and that means abdominal infection can occur, splenomegaly, leg ulcer, and frequent infections, and anemia. Mostly HB level is 6 to 9 gram per deciliter. These are the important points of the signs and symptoms of the signs and symptoms of the sickle cell anemia. What are they? Colic, splenomegaly, leg ulcer, frequent infection, anemia, and the other one hand-foot syndrome, and the complication and the thing is osteomyelitis can occur. So the main diagnostic evaluations are the complete blood count. While checking the blood count, we can check the hemoglobin level to rule out the anemia, and also we can notice the increased reticulocytes. Okay, and while doing the peripheral smear, we can see the sickled shape of the RBC. And the hemoglobin electrophoresis can be done. That means while checking this hemoglobin electrophoresis, here we can see the concentration of the HbS is high while comparing with the HbA. HbA either absent or reduced in concentration, and but the concentration of the HbS will be higher. Okay, that means if there is an increased HbS, that indicating sickling of the RBCs or sickle cell anemic traits. And also we can check the organ test also, that means the renal function test, liver function test. We can do it and we can find out is there any organ damage. Okay, these are the main diagnostic tool used in the diagnosis of the sickle cell anemia. And also we can see the splenic sequestration crisis, that is a complication of the sickle cell anemia. That means the spleen will become infected, there is an enlargement of the spleen. What happened in this splenic sequestration crisis? There may be the large amount of blood is pooled in the spleen. That means the blood will not come out from the spleen. The blood is stagnated inside the spleen. It can lead to what? Severe anemia. That means the concentration of the HB is low in the blood, and it can lead to hypovolemic shock. It's a life-threatening complication. That means the splenic sequestration crisis is a life-threatening complication of the sickle cell anemia. Okay. So, so far we have discussed the definition, the risk factors, pathophysiology, signs and symptoms. Hope you got a clarity on the sickle cell anemia. Next we can move on with the management. Mostly the management, we know here the sticky or the stagnation of the blood is happened. So what we can do, we can administer fluid, IV fluid. Why? Because we need to dilute the blood. Okay, the sticky blood need to get diluted. Okay, or the stagnated blood is need to get diluted. How it can? By administration of the IV fluid. Adequate hydration or administration of the IV fluid is the primary management for sickle cell anemia. And also we know there is an existing hypoxia because of the low hemoglobin level. So the client oxygen saturation level will be low. Okay, low saturation level, and if we monitoring the oxygen saturation level we can see that there is a low oxygen saturation. It indicating hypoxia. The client need what? Oxygen therapy is needed. And there is severe pain because of the hypoxia and infected changes, so the client need analgesics for the pain. But the meperidine is not indicating in a sickle cell anemia. Why? Because the meperidine, the drug, when we ingested, the drug will metabolize in the body. Okay, and when we metabolize of the meperidine causes the formation, the name of the metabolite is the normeperidine. Okay, and this normeperidine causes the toxicity symptoms. That means the repeated dosing of the meperidine can cause toxicity, and it can lead to seizure. Okay, that means so that it can cause seizure. So the meperidine is not ideally not recommending in a sickle cell anemia for the pain management. Okay, and also hydroxyurea can be what can be administered, that will increases the fetal hemoglobin. Okay, hydroxyurea. And we know the child will more prone to get infection, so antibiotics needed. And incentive spirometry, that means the lung is getting affected, the secretions will become thickened. So to improve the lung compliance, the patient need to take incentive spirometry, that means to increase the lung capacity. And also exchange transfusion. Why? Because the sickled hemoglobin needs to be replaced with the normal hemoglobin. So blood transfusion or exchange transfusion is the another management for the sickle cell anemia. So these are the highest management measures for the sickle cell anemia. What are they? Hydration, oxygen therapy, analgesic management, mostly opioid, and avoid meperidine, and hydroxyurea to increase the fetal hemoglobin concentration, administer antibiotic to prevent the infection, incentive spirometry to promote the lung compliance, and exchange transfusion to replacing with the sickled hemoglobin. Okay, and surgical management, mostly splenectomy. That means if the splenic sequestration syndrome can be managed with the splenectomy. That means the removal of the infected spleen can be get what that means this when the spleen will become infected, it will become non-functional. That means functional asplenia can lead, and here what happened, we are getting more, will be become immunocompromised, and the patient will more prone to get other infections, mostly the streptococcal pneumonia, the Haemophilus influenza type B, and the meningococcal. Okay, and the most important vaccine we are recommending for the patient is the pneumococcal vaccine is the recommended here, because the patient is more prone to get infection. Okay, and also we know that in the sickle cell there is the normal hemoglobin is getting destructed. Okay, and so there is the high demand of the oxygen is needed. Okay, so here we need to supplement with the diet. That means the oxygen level in our blood is low, so there is aerobic respiration will not happen in the cells. Okay, so what happened, we need to supplement the energy. How we can supplement the energy? By supplementing with the high calorie, high protein, and supplementation with the folic acid. These are the main supplementation needed in a sickle cell anemia. Why we high calorie diet? That is to increase the energy production, and the protein will supplement, or protein will act as a building material. Okay, and the folic acid is required for the production of the RBC. So these intake nutritional diet, that means increase calorie, increase protein, and the folic acid supplementation is needed for the sickle cell anemia. And while coming to the nursing management, we know the cold atmosphere always cause sickling of the RBC. So maximum we avoid cold exposure. Okay, and we can apply the warm application can be provided. That means extra clothing can be given to the patient. So keep the patient warm and avoid cold exposure. Adequate rest is needed, because if the client is doing heavy action, what happen, the client need extra energy, but the energy is low in case of sickle cell anemia, because no energy, adequate energy is not producing because of the sickling of the RBC cause vaso-occlusion. It can lead to vaso-occlusive crisis. So here the adequate rest is needed for the client. You can supplement with the high protein, high calorie and folic acid. And vaccination, mostly hemophilus influenza type B, pneumococcal vaccine, meningococcal vaccine can be administered. And we know the skin care is needed because there is a risk for getting easily bruising of the skin and leg ulcer can be occur. So the proper skin care need to given to the client. Okay, mostly question can be asking from the keeping the body warm and the avoid cold exposure, high protein diet, high calorie, folic acid supplement, good skin care. Okay, the main focus you need to focus on the hydration, oxygen therapy, analgesic administration is the important management in a client is going in the stage of crisis or sickle cell crisis. Okay, and in addition we can give the supplement treatment, hydroxyurea, vaccination, blood transfusion, bone marrow. In severe cases the client need, that means in case of osteomyelitis or all, the client need bone marrow transplantation. Okay, so the question can be asked from the management, hydration, oxygen, pain. These are the first three priorities in the sickle cell anemia. And the cold exposure cause vasoconstriction, so it can cause worsening of the sickling. So avoid exposure to the cold. We can apply the warm application. And another complication, acute chest syndrome, that means the pneumonia can cause what? Life threatening pulmonary complication. The sickle of the RBC cause vaso-occlusive crisis. So what happen? It can affect the lung also. The pneumonia can lead to what? Infiltration of the lung, and it can lead to respiratory distress. So if the acute chest syndrome is noted, okay, we can check the saturation level, we can check the breathing pattern, we can check the respiratory rate. Okay, like that we can assess the acute chest syndrome. If it is not a acute chest syndrome is not a, the client need immediate management. It is a complication. Okay, the splenic sequestration syndrome and acute chest syndrome are the main complication of the sickle cell anemia. And main surgical management, splenectomy. Splenectomy means removal of the spleen. Otherwise what happen, this infected spleen can will cause the recurrent infection. So to protect the patient from getting recurrent infection, the client need to undergo for the what, splenectomy or the removal of the spleen, infected spleen. So these are the highlighted NCLEX focus for the sickle cell anemia. So I have added many questions here, but I will discuss one question. Okay, so and I will tell you how the question can analyzed. Okay, so in the first we need to understand the scenario. So what is the scenario here? Using the method ISBAR. ISBAR means ISBAR. Okay, ISBAR is the main communication tool we are mostly using in the hand and taking over. So, but in this ISBAR tool can assist in the scenario analysis also. Identification, situation, background, assessment and recommendation of treatment. Okay. So here about we need to identify the patient. What is the identification of the patient? A 17-year-old. Okay, boy or girl, that doesn't matter. 17-year-old patient. What is the diagnosis? Sickle cell disease. That is the situation where it's arrived in the emergency department. What are the other complaints here? Generalized pain, swollen hands. Okay, so and oxygen saturation is 89%. So what is the question here? We need to identify the keyword in the question. Okay, that means assessment. What is the assessment? Saturation is 89% only. What is the situation? Generalized pain, severe pain, swollen hands are the situation. What is the diagnosis or background information? Sickle cell disease is the background. Background means history of the illness. Assessment we got, identification we got, situation we got. Okay, everything we got. Next we need to find out the recommendation. That means here what is the treatment? The provider order should the nurse implement first. That means the physician has given some orders or recommendation. What is the keyword here? The provider order should the nurse implement first. That means the priority action. Okay, priority nursing action, we need to choose it as the correct answer. So we know what is the order of the management of the sickle cell anemia, the sickle cell crisis: hydration, oxygen, and administration of the opioid analgesic. These are the main three priorities for the sickle cell anemia. So we already got the patient has sickle cell anemia and the patient is complaining with generalized pain, hands are swollen, and saturation is 89%. That means client need oxygen, client need analgesics. Okay, and also we need to categorize the immediate priority management. We know the hydration is the highest priority. We can read the options: start the IV normal saline at 150 ml per hour, administer morphine, apply warm compress to extremity, obtain blood culture. All these are important management. Okay, so we know that we need to how the priority is coming: IV fluid. Okay, first order this IV fluid, second one is oxygen, and last one is opioid analgesics. Okay, this is the order of the sickle cell anemia analgesics. Okay, so in this we know what is the primary IV fluid. So while reading the option, start IV normal saline at 150 ml per hour, yes, of course is needed. Why? Because we need to give adequate hydration. That means we need to prevent the sickling of the RBC before administration of the oxygen. What here the client need the hydration. Okay, so and administer morphine can be an answer, but it will come later as comparing with the IV fluid. So we can eliminate option 2, use elimination method. Next one, apply warm compress to the extremities. Yes, of course warm compress can be applied, but we know that before that the primary management is what? IV fluid is the primary management. So we can eliminate option 3 also. Last one, obtain blood culture. But if here nothing has mentioned about the fever and all, and if the client has showed the symptoms of fever and all, and if there is any the client is going in the stage of infection, we should take the blood culture. But this is not suitable priority management for the given scenario. Okay, the given scenario, what is the primary management? IV fluid. That means here we know the normal saline is a isotonic. Isotonic means the same concentration as with the blood. That means it can increase the blood volume. Okay, that means when we administer isotonic solution, it can cause rapid increase in the blood volume. Okay, so normal saline is a isotonic solution. So the correct answer is what? The correct answer is administration of the IV fluid. That means the administration of the normal saline. That is the correct answer here. Okay, so you got a clarity on how a scenario is analyzed. So yes, the correct answer is start IV fluid. Why? Because the hydration is the first priority. That means the main reason for this generalized pain, the hypoxia and the swollen hands is the vaso-occlusive crisis because of the sickle cell anemia. So what we can do, we can reduce the viscosity of the blood. Okay, so when the viscosity is getting improved or thinned or loosened, what happened? Automatically the blood flow will get re-established, saturation will get improved, the swelling will get vanished. Okay, so why we are not giving morphine as the primary management? Of course the client need pain control, but as comparing with the pain management and hydration is the primary management. Okay, warm compress can be helpful to reduce the pain, but it will come least priority. Blood culture is needed only in case of suspected infection. That is not a life-saving priority. So what is when a client is going into a stage of sickle cell crisis, what is the primary management? hydration, oxygen and analgesics. Okay, so hope you got a clarity on sickle cell anemia and the question, how the theory applied in the question analysis, and how a scenario is analyzed using the SBAR tool, and how I applied the elimination method, and always we should correlate with each option, compare, and most priority we should choose it as a correct answer. So if you have any doubt, you can send message, and if you are satisfied with the class, you can join for our class, and if you want to know more about the details, you can send me the message. Thank you.